Clare Daly has 2.5 minutes.
Corla. Minister, I think if you asked the questions that Deputy Wallace asked and you sought the answers, that we'd have an exercise in public accountability this afternoon far better than anything we've done in our terms in here. And I have to say I agree that this afternoon's sort of political theatre has been utterly demoralising from all sides of the House, to be perfectly frank. I mean, I was down this morning with the frontline staff in the cervical check unit in the Rotunda. Fantastic people who provide, and I'm not afraid to say it, a world-class service. A world-class service. And you won't be surprised to hear that they're not waiting for Stephen Donnelly or me or anyone else in here to come in and clear the backlogs. What they would like is for the politicians to allow them to do their jobs, to resource them adequately so that they can do it, and then back off. Listen to the advice and then back off. And the reality is, if you had listened to the advice of medical people, we would not have provided the retest and all of the subsequent problems, which is only a part of that problem. Now, I've been very balanced and in my dealings with you in terms of your responsibility in that regard, and I don't blame you personally or solely for that. But I do think that, contrary to your protestations that you didn't know and that you didn't act against medical advice, that there is information now in the public domain that says that that statement isn't true and that you may, in that sense, have misled the Dáil. I also take great offence at your statement that you will stand up as one of your gestures here to us is that you're going to bring in mandatory open disclosure. Sometime, maybe next year. We heard it last year from the Taoiseach. But the saddest thing is that myself and Deputy Wallace had secured mandatory open disclosure over 2 years ago, and with the help of Fianna Fáil, lobbied for by the heads of the Department of Health, that amendment was overturned. So we could have had it in place. And the cervical check crisis at its heart is a crisis of open disclosure. But look, I don't think you're the only one to blame, but you are the one at the helm. And, you know, the National Children's Hospital is going to go down as one of the biggest scandals in the history of the state. But for me, the saddest thing is that it's not history. We're living through this fiasco. And if you ask the questions that were being asked by Deputy Wallace and get the answers, then I think we can retender, we can get real accountability and get justice once and for all for the taxpayers.
Deputy, thanks for observing the time. The Rural Independent